good? Good morning, everyone. First, let me start off by welcoming Congresswoman Clark to Revere and thanking her for her extraordinary partnership and leadership and all of her hard work to advocate on behalf of all of our residents. We are approaching the one-year anniversary of our city shutdown, and the light at the end of the tunnel is shining brightly, especially this week. For the first time in 1 year, Revere students will return to school buildings for in-person learning starting on Monday. Thanks to a partnership with East Boston Neighborhood Health Center, over the next 2 weeks, we will work to vaccinate all of our Revere Public Schools staff and teachers here at the Rumney Marsh Academy, and that will be starting next week. And our public health team is working diligently to bring more consistent and widely available vaccination clinics to all of our eligible members of our community, including our veterans, daycare providers, and our seniors. As we make significant progress on vaccination, it's important that none of us forget that the virus continues to pose a threat to the progress that we are making and that we must remain vigilant. This week, we did reopen the city's basketball courts, and our Parks and Rec team will continue to monitor activity at those courts, providing masks and reinforcing public health guidelines. Our economic development team is working to support our local business owners in their recovery and ready their operations for the spring and summer months. And testing will remain a major part of our strategy to safely reopen. In partnership with Mass General, Brigham, the city's mobile testing van will continue to offer up walk-up testing in multiple neighborhoods in our city. I'll end with the fact that federal funding has played a major role in our city's ability to respond to our residents' needs and to the challenges of this pandemic. And I cannot thank Congresswoman Clark enough for her role in getting dollars delivered to cities and towns quickly with the right amount of flexibility so that we can put it to work for our residents. With CARES Act funding, we've been able to dedicate more than $1 million to help residents with mortgage and rental assistance. We've implemented a first-of-its-kind ambassador program to meet our residents where they are in our neighborhoods with critical services. And we've sheltered our homeless and provided our residents with convenient testing options. We're eager for the passage of the American Rescue Plan so that we can continue to meet the needs of our community and meet the needs of all of our residents so that we can continue to support our schools, increase our public health capacity, and maintain our city's strong financial footing. With that, I will turn it over to Congresswoman Clark, but before I do that, I do want to present her with her own Rumney Marsh Academy mask. So, Congresswoman, thank you so much, and thank you for everything.
Thank you. I am delighted. I did ask for this specifically, so thank you. I look forward to wearing that in Washington with great pride. And I want to thank Mayor Arrigo, his incredible staff, Lauren Buck, Superintendent Kelly, Dr. Kelly. We are joined by State Representative Giannino, and so many of our city councilors. There were even more here earlier, and we appreciate your incredible partnership. And walking through the vaccination clinic, talking to teachers who are anticipating the return of the students here, talking about their experience, everyone from the mayor down to the custodial staff here at Rumney Marsh Academy have had a part in the success of Revere meeting a very devastating pandemic. The spirit of this city is on full display here today. And my role is to be a support for that and a partner. And I am so grateful not only for just having walked through that clinic and the hope that is being delivered to the city of Revere, the talk about the ease of which it was to get an appointment, and not only getting to meet the great ambassadors and volunteers who've made this all work and supported the Department of Public Health and everything that's being done here today, but having visited Revere and seen what they've been doing with food distribution and PPE distribution, it speaks to the spirit of a city that has been so hard and disproportionately hit, and met this with great science, with the resources needed. And what we are hoping through the legislation that we hope to complete and pass next Tuesday is that we can give this lifeline, that we can help our local communities build on the success that we've seen here in Revere, that we can get the funding, whether it's the survivor checks going directly to community members who need it to keep food on the table, to keep a roof over the head of their families, whether it is the relief to small businesses that make up the backbone of the economy here in Revere so they can stay open and survive and thrive, the funding to schools to help be able to expand the faculty here and to make sure they have what they need to have students back learning and having the keys to be safe and successful. Whether it's the funding for vaccine programs, so we get the shots in the arms, just like we're seeing happen here today, and make sure that we defeat this pandemic so we can build back, not just status quo, but an even more inclusive economy. All of this is what we are hoping to do in the federal government to support our state and local governments. If the funding levels hold from what the House passed, Revere would receive $20 million to support all the incredible efforts that they have had to undergo. And that story will be played out across the Commonwealth. This is our time to meet these historic challenges like Revere has done, with historic progress and a focus on helping those who have suffered so much loss during this time. But this is an example of what investment in our people, in our neighborhoods can do. And it is an example for the country of how we can come together, make these critical investments in one another so that we can get through this and rebuild in a way that gives everyone a fair shot at opportunity. So I am so grateful for all the partners. Mayor, your extraordinary leadership that just is seen from everyone on your staff and everyone in this city that we have talked to today and over the course of the last year. And I'm grateful for your input into how we can make this funding flexible so that it works for local communities and states. You truly are an example. I will wear my face mask with great pride, and we would be happy to take a few questions. Thank you.
Congresswoman, you've been somewhat critical of Governor Baker's vaccination plan. Certainly the VaxFinder website has had its bumps in the road and difficulties. What grade would you give the governor, and do you think those problems are being ironed out?
You know, I think one thing that we could foresee was that we were going to need a vaccine program. And I think Revere is a great example of having that foresight and putting into place what they needed, those partnerships with community health centers. All the appointments here today, I believe, are made through the senior center with phone calls and backups. And that is exactly what I think, if the state had been able to do that, we could have gotten vaccines even quicker into the arms with less frustration. And here in Revere, we are also addressing the equities of access to health care. We know Revere is one of those communities that has disproportionately affected by a lack of access to health care. And so this is really an example of where we can do this even in the most vulnerable communities. So I think the state has made some progress. We are certainly going to keep up our end of the bargain in helping them get more supply, and also letting them know so they can count on when exactly and how many vaccines are going to come. But I think Revere is an example of how to do this correctly, how to make sure that people can get and access this vaccine quickly.
So it was a mistake to take away the ability of local cities and towns to do vaccinations?
I'm certainly glad that we have been able to keep this vaccination going. I think our local communities are such key partners in this because they're closest to the needs of the people. And I hope that as we go forward, we can have a combination that uses the incredible resilience of a community in a city like Revere, but also have those mass distribution sites. Our goal is to get as many shots in arms as possible. That is what our funding in ARPA is going to be aimed at the American Recovery Plan, and that is what we need to see and supported here in our local communities.
What do you say to the communities like Revere that feel that they have sort of been abandoned, I think, to some degree by the state level, and maybe to some degree at the federal level, as they try to do this? I mean, Revere has done a lot of this on their own. They have received, of course, funding and help, but certainly, at the state level, a number of communities have felt that they are not being listened to, that they've sort of been shunned aside in terms of trying to deal with this. And here it is, this is what you do. What would you say to them?
I think that we have to take into account, and that it is so important to listen to our local leaders, our local public health officials, because they are on the front lines of this pandemic and how we can quickly get back. So we have to do a better job at every level of listening. And that is why we have fought so hard in the House of Representatives to make sure that local funding is part of this relief package, because we understand the number of resources that have gone out and that the need has been met, whether the state or the feds are helping out. That's what the mayor has shown in the city of Revere, that he is going to meet the needs of his community and worry about how he is possibly going to put this back together, but do it at the same time on parallel paths. And so that's the help that we have been fighting for. We passed that state and local aid in the House back in May, almost a year ago. And we are hoping that that is finally going to come to fruition so that we can help build our local connection in this package next week.
Congresswoman, early on in the Biden presidency, the president pledged transparency. Recently, our governor and others sent a letter to the administration looking for more insight in the vaccine process. This week, Governor Baker said he found out about the teachers through a tweet. Is there a communication issue, and what needs to happen?
One of our goals is always to strengthen our communication, and I think that's another thing that I so appreciate about the mayor, his administration, is helping me be better informed, making sure that we know the issues that we need to work on. A great example that we were talking about earlier is that I heard from the mayor that flexibility around this funding was key. So that's what we fought for. So this funding wouldn't have a cliff in December, but it could really address the needs for the next few years, that even as we get this vaccine distributed. So we always need to keep those communications strong. And I think what the Biden administration has done that is so critical is set a national strategy for vaccines, communicating, improving, setting a goal for getting vaccines out, and now even making that a faster goal, moving it back to what we hope will have the majority of Americans vaccinated now by the end of May instead of the end of the summer. So yes, that's always our commitment to being transparent, but this administration has really put in place the national focus and strategy that we simply did not see from the former one.
Do you expect the bill will get through the Senate and get back to the House? And in what form?
We will see what form. There is nothing that has ever come through Congress exactly as it passed from the House, but I think the key pieces are going to be there for rebuilding our economy. the survivor checks, the money for vaccinations, state and local government, making sure we're investing in our schools and childcare so we can get parents back to work and kids back into their education. These fundamental pieces are going to be there. We are anticipating that we will take it up in the House on Tuesday.
Mr. Mayor, can we ask a couple of questions?
One more question?
Yeah, that's all.
Okay.
I guess I just wanted to get your reaction to the fact that, Congresswoman talks about the health and assistance that you receive from the state. I guess I want to get your perspective. You have done a lot here locally on a local level. How have you felt? Do you think that the state and federal government has helped you out? Could they have done more? Have you felt abandoned at times?
So I don't think that I've had much time to think about that, to be honest with you, because we've been so laser focused on meeting the needs of our residents, right? And being able to step up and leverage all that we have, right? If it's our janitorial staff that's helping us create a vaccine clinic, people have been willing to do that. And so what I've been laser focused on, and not necessarily thinking much about how we're going to get help from the Congresswoman or from the governor. It's more about my residents and how we're going to meet the needs that they have and how we're going to use the pieces that we have to do that. I don't really want to comment on things that are out of my control, right, in terms of even...
More help, though, I would imagine.
Every conversation I have with either state or federal partners, as you heard from the conversations that I've had with Congresswoman Clark, is about how to help us get the resources that we need. I don't think it's a great use of my time to take shots at anyone we're all working really hard to meet the needs of the residents of the Commonwealth, our cities, and the entire United States of America.
So, Mayor, this site here is a regional collaborative doing at least 750 shots a day?
No,
right?
this site is stood up in partnership with East Boston Neighborhood Health Center, in partnership with our local Board of Health. So that's kind of outside of the regional collaborations that the state has been looking for. We've really leveraged, and it goes back to the kind of laser focus that we've had. I don't spend a lot of time complaining about what the governor may not be doing. I'm taking my time to leverage the partnerships that we have and figuring the resources that we need to get shots in the arms for our seniors and for our teachers next week, for example.
So just for Revere residents?
So this is for Revere residents right now. We will have, as I said, a clinic next week for our public school staff, and then we're looking at leveraging further resources and partnerships to be able to do a bigger site at some point. We expect to be able to do that later on this month.
Thanks, everyone. Thank you for coming out. I'm happy to help you get back into the clinic.
Thank you, Congresswoman. Appreciate it.
Thank you.